The Medical Cost Sharing Program is not an insurance plan. It works by taking contributions from each member and putting them in a pool, which then pays out for any major medical expenses when needed by those members. This type of community sharing is not new. It has been around for over 30 years and has over 1 million members. Some important elements to understand: as a good steward of the community funds, you always want to get the best price for any needed medical services. And one way to do that is to let your doctors know that you are a cash pay patient. Almost all medical offices and hospitals have a separate cash pay charge list, which is significantly less than what is billed to insurance companies. Of course, insurance companies never pay what is billed, so the cash pay charge list is actually close to what the medical practices end up collecting from insurance companies anyways. So it's not a loss by any means for the healthcare system to give you cash discounts. Also remember that your medical cost sharing program is there to share in your need when it exceeds either $1,000 or $5,000 and is due to a new problem or a complication from an existing problem. So a couple of terms to learn about in medical cost sharing programs. The first one is IUA, or Initial Unshared Amount. You have the option to enroll in either the $1,000 or the $5,000 IUA program. This basically means that for any need or event that requires assistance, you have to pay either the first $1,000 or the first $5,000, and the remaining amount is shared with the medical cost sharing community. Think of this like your good faith contribution towards your need before asking the community to help pay for the remaining expenses. Next term to understand is a need. A need should really be understood as an event that is caused by an illness or injury. There is no time limit per se, so it can last for several months, and there is no restriction of calendar years. Once you have contributed your initial unshareable amount, or IUA, towards that need, all remaining expenses are shared with the community. And you are protected against any more personal expenses for 12 months, should there be a relapse for that same need or condition. However, you are expected to pay your share, the IUA, for each unrelated need. So, for example, if you end up in the hospital for pneumonia, and then at another time you get admitted for abdominal pain, each of these is a separate need, and you will be expected to pay either the $1,000 or the $5,000 for each need before the medical cost sharing community shares in the expenses. However, in a 12-month period, you have a maximum of 3 needs where you have to contribute to the IUA. After this, any more needs are fully shared with the community from the first dollar onwards. This is extended to families as well, with a maximum of 5 needs, where the IUA is applied, and after that, all further needs are shared from the first dollar onwards. Let's address the pre-existing conditions. This provision is put into place to protect the community from someone who has been diagnosed with an expensive condition like cancer, and then decides to join the community to help share in that expense. It won't be fair to other community members to have to pick up the financial burden in this situation. However, if a member is diagnosed with a condition like cancer while they are an active member, then the community will share in the expense of that treatment. So there is no testing or medical exam requirement for joining the community. However, when a claim for a need is made by the member, there is a look back of up to 36 months of medical records to ensure that this need is not a result of a pre-existing condition. There is a graduated rate of sharing for complications from these pre-existing conditions. There is no assistance in your first year of membership. You get a maximum of $15,000 sharing in second year, which goes up to $30,000 in the third year. And then from the start of the fourth year onwards, there is no limit on sharing. Please bear in mind that these restrictions in sharing only apply to needs that arise from pre-existing conditions, not for issues that are new after having joined the community. How do you know that you have a pre-existing condition? Ask yourself 3 questions. Have I been treated for a medical condition? Have I been given a diagnosis of a medical condition? And am I having active symptoms from this condition? Remember that managed conditions not causing active symptoms should not be a barrier to joining the community. This is a great reason to join the community when you are healthy. So if and when you have a medical condition that may arise, you are getting the financial support from the medical cost-sharing community without any worries about pre-existing conditions. Let's look at an example in a more practical sense. Tom is enrolled in the $1,000 IUA program. He discovers some blood in his stool, so he visits his doctors and pays $125 for his office visit. Doctor gives him some medication which doesn't help, so Tom goes back to the doctor for reevaluation, and his primary care recommends seeing a specialist. So Tom sees a gastroenterologist who recommends a colonoscopy, which shows a polyp and no further action is needed. The total cost for this need for Tom is $2,900. Tom pays the first IUA of $1,000, and the remaining $1,900 is paid to Tom by the medical cost-sharing community. This way, Tom is in charge of his care, and his doctors know that Tom is paying for his care, which makes Tom their customer.